start now. A very good morning to all the pink attendees. This is Jamila from Friends of Cancer Patients. We are pleased to present in collaboration with the Zulekha Hospital a health webinar about cervical cancer signs and symptoms presented by Dr. Bushra Gul, specialist obstetrician and gynecology in Zulekha Hospital. I would like to request all the attendees before starting the session to keep the questions and the answers at the end of the webinar. And please join our Friends of Cancer Patients YouTube channel. And inshallah, if there is anything, we will keep it at the end. And certificate link, inshallah, will be shared during the session. So over to you, Dr. Bushra. Thank you so much for your time and efforts. So the slot is yours. Thank you.
Thank you. I'm Dr. Bushra from Zulekha Hospital, and I'm practicing OB/GYN, and I have my own experience of 2 pregnancies and births. And I'm a strong advocate that patients should be leading their care after they get the necessary information that is called informed consent. So today, Cervical Health Awareness Month, that is January. So in honor of this month, I would like to take this opportunity to talk about cervical cancer and how we can prevent it. So what's the cervix? Cervix is the womb entrance. This is the same part when mom is giving birth, doctor keep on telling that cervix is dilating, and then baby travels through cervix to be delivered. It is part of the uterus, but it is distinct from the body of the uterus. So are the diseases. It's prone to different diseases than the uterus. Cervical cancer, it's 100% preventable and highly curable, but unfortunately, it claims 300,000 lives each year. And this is, and there are so many measures which we can take to prevent cervical cancer. Normally, WHO defines the level of prevention 3 levels: primary, secondary, and tertiary. Getting HPV vaccination is the primary prevention. It means you stop the disease from happening. Secondary prevention is when you diagnose the disease or you pick the disease when it's still preclinical and patient may be having symptoms and patient may not be having symptoms. Then last but not least is the tertiary prevention. Tertiary prevention is when the disease is already diagnosed and you stop it having more morbidities and possible mortality. Then human papillomavirus, which is the most common cause of cervical cancer. It has many types. There are more than 100 types of human papillomavirus, and more than 15 are linked with the cervical cancer. In US, it is all the women, 80% of the women, they get HPV during their lifetime. In UAE, it is second most common cancer, the cervical cancer in women. And vaccine is there and vaccine can prevent it. Primary prevention, it's all about preventing HPV. So things like having multiple sexual partners and safe sex, these are the factors which can affect having HPV. If somebody has weakened immune system or doing smoking, that doesn't let women throw off HPV, because a lot of women after getting HPV, they still, throw off the infection and they become infection free. And of course, HPV vaccine is really important. HPV vaccine, it's widely available and it's the basic step in prevention of cervical cancer. As a doctor, I recommend all the preteen girls to get vaccinated. As a mother, I will recommend my own daughter to get this vaccine when she is at the right age. There are different FDS approved HPV vaccine from age 9 to 45. So women who haven't been vaccinated and they are within the range of 9 to 45, they can avail the vaccine. There are 3 types of HPV vaccine: Cervarix, Gardasil, and Gardasil 9. Gardasil 9 is the best vaccine because it covers 9 and 15. They can have shots, but after 15 years of age, they have to take it all 3 shots. It's 100% effective against the strains for which it is being given. Side effects: 74% of the people getting jab, they get the side effect, but 64% of the people getting placebo also get the side effect. So it's not necessarily vaccine related. Headache, nausea, fever, it's very common. So these are also common. Somebody gets the HPV infection. Injection site reaction, it happens in 2 out of 3 people, and occasional fainting is also there. And there's no booster dose recommended. Cervical screening, when to start? Somebody getting HPV infection, it takes 20 years to develop cervical cancer. So one can imagine there's a lot of opportunities to detect HPV and cellular changes which can lead to cervical cancer. 21 to 24 years is an optional age. One can start and one cannot, but 24 to 65 is an age recommended to do the cervical screening. If you're doing alone cervical screening, it should be every 3 years till the age of 49, and then 5 yearly till the age of 65. But if you're doing HPV testing or HPV alone testing, then you can space it out 5 years, every 5 years. When to stop? If you had a surgery in which you removed your uterus completely, then you can stop. Or if somebody is 65 years of age and their all previous screens were normal, they can stop cervical screening. How it is done? This is the way, like one can see, you will lie on your back and doctor will insert a speculum to widen your vagina, and you don't have to clench on the instrument. You have to take deep breaths, and you should consciously relax your muscle so it won't be uncomfortable. And doctor will brush off the cells from the cervix slightly, and they'll send it to the lab. When you're planning your cervical smear, you shouldn't be in the periods, and you should avoid intercourse and having any vaginal medication 48 hours before the procedure. After the procedure, you can have mild spotting or bleeding, which will be 1 to 2 days. And you can go about your activities after the procedures. There's no restriction. After the test, you must ask your doctor, how would you follow your results? Because it's very important after completing the procedure to know your results. Then cervical smear results, they can come either normal, abnormal. So if they're normal, then you will be, your doctor will ask you to have routine checkups in future. If it's abnormal, the next step is colposcopy. This is the colposcope, which is a magnifier. It has this is the camera, which is just hidden behind this panel. And this is magnifier with the special filters. So preparation is the same, like you will not plan it during the periods, and you will you will not have intercourse or any vaginal medications 48 hours before the procedure. Procedure itself is the same way. You will lie on back. Doctor will introduce the plastic instrument, speculum, to widen your walls, and they will apply some special liquids, and you might feel tingly after that. And they will find any suspicious area. They will take cells from that is called colposcopic biopsy, and they'll send it to the lab. Post procedure, if doctor hasn't taken any biopsies, just the same, you will not have any restriction. You will go about your business. But if doctor has taken biopsy, then you might have to avoid intercourse and putting any vaginal medications for 3 days. And yeah, and you will ask your doctor at this point how to follow the results, which is very important. Once somebody is diagnosed that they are having suspicious cells or they are having cervical cancer, stages are there, medical stages, but in the broad way, for simple understanding, this could be early stage cervical cancer, which we can see, I mean, it's just these blue areas, which are just, it is even after being cancer, it is slow to grow. So for till stage 4A, it is even advanced, it advances locally. And then there is a disease, which is the last 4B, which is advanced stage or distant disease. Early stage disease is completely curable by surgery and with very less chance of recurrence. Even in advanced stages, there's a locally advanced stage that can be also treated by surgery or radio chemo combination. Distant advanced disease is treated by chemo, radio, or palliative care. So my message is, don't let cervical cancer stop you. Get vaccinated yourself, get your daughter vaccinated, and get screening on the proper timings.
Thank you so much, Dr. Bushra, for this informative session. Now, I would like to request the participants, if they have any questions, either in English or Urdu, they can head it to Dr. Bushra, and she's more than ready to answer you.
I just want to, since nobody has a question, I see people have a lot of fear about the HPV. But HPV is a very slow disease. Even if you didn't get the vaccination, it's very, very slow. Like even after getting HPV, one gets, it's 20 years window period when you can just do the screening and you can detect the bad cells, and it is treatable. So if somebody gets cervical cancer, it's just a failure at too many levels to reach to that point. I mean, you feel sad if somebody gets cervical cancer. And especially in UAE, everybody has insurance. They can just go to the hospital and get their cervical smear. And not just that, like a lot of hospital, like our hospital, we have a free campaign for the cervical cancer smear, cervical smear. So even if somebody follows that time, like when we are having the free cervical smear, I mean, they can just get it done at least, like not yearly, it has to be 3 yearly. So it's very sad if somebody is still ending up cervical cancer.
So, Doctor, I'm going to ask you, is this cervical cancer vaccine?
It is 3 shots. And that's the best step, actually. Primary prevention is stop the disease from happening.
Thank you so much, Doctora. So because no one has any questions, and I think the lecture was quite clear, So today, inshallah, we will end up the session here. Thank you so much for your time for this informative session. We are really so much grateful to have you on board. I would like to request all the participants to subscribe on FOCP YouTube channel and to subscribe on all Zuleika social media channels for the updates. I think, Doctor, there is one question. Okay.
Yeah.
No, there is no questions from the attendees. So thank you so much, and we will end the session for today. Thanks a lot.
I also want to thanks the FOCP for giving me this opportunity. Thank you.
The pleasure is ours, Doctor. Thank you, and thank you so much to our lovely attendees. Thank you. See you later
Thank
on.
you. Thank you,
Take care.
Jamila. Thank you, Dr. Bushra.
Thank you, Samina. Thank you.